Hello, everyone. So, bottom of the morning to you. It's almost morning is almost over. It's 11:32. I'm just drinking my soursop tea, and I was about to take a shot of my black walnut tincture. This tincture I have since 2017. I do have a walnut tree, a black walnut tree in my backyard, and I did save the hucks and pour vodka over them in 2017. So you know this is charged, and I strain it off about 2 years later, and we've been drinking shots of black walnut tincture. Now, back in the day, people used to take Parasite cleanses, stuff to, because do you know that the body hosts worms and parasites naturally host worms and parasites. So we don't want these things overgrowing in our system. So we need to take things to eliminate these parasites and worms from our body, where they don't go lodge into our brain and then being picked up on like MRIs as cancer. And then when they go in to do the surgery, they find live parasites and worms in our brains and different parts of our bodies. If we just do basic things, we can actually eliminate these worms and parasites from our body. So today, before I do that, I want to tell you a little story about growing up in Jamaica. I grew up in Jamaica, and in my little island, we play outside as kids. And I remember, I won't say who she is, but she knows herself. One day I was playing with my cousin. We were playing outside, I don't know, dollhouse or something. We were playing dolly house. And she had to pee. So, you know, as a kid in the islands, if you have to pee, you don't go inside to go pee. You just go to a corner and pee. So she peed, and after she peed, we noticed that there was a worm kind of, whisking around in her pee. So I was like shocked, like, what the hell is that? Because I've never seen that. And of course, I questioned my mother. I said, Mom, we were playing and she had to pee. She went and pee, and there was a live worm that came out of, I don't know where it came from, if it's her bottom or her vagina, who knows? But there was a live worm kind of wiggling around in her pee. And my mom explained to me that some people we all have worms inside our body, and that's why so I said, but I never see that in my pee. This is my curious 5-year-old now, questioning my mother. And she said to me, you wouldn't see worms in your pee because I give you something called Tyrax. As a child in the island, you're given worm medicine, Tyrax. So what the Tyrax does, it breaks the worms up and eliminate them in your feces, so you never get to see those worms. And if you don't do cleanses like parasite and worm cleanses, these things will exit the body whole and alive. And that's what I experienced as a 5-year-old. So today I want to tap into how parasites harm the body and how they show up in our system today, because we're thinking, because, oh, we're not drinking contaminated water. Oh, this is for the third world countries where people are still drinking contaminated water. That's where parasites and worms are showing up. No, 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 no. Right here in these United States, we're having the issue, but we don't know that we're having it. This is how it's showing up. It's showing up as gastrointestinal distress. Common symptoms causing diarrhea, gas, bloating, nausea, cramps, and even vomiting due to parasites feeding and damaging the gut lining. Did you know that? That just, you see them people who out there eating this raw meat. Oh, I want my steak rare. Yeah. When was that cow killed? How fresh is that meat when you're eating rare cooked beef and then you end up with a stomach virus? Yeah, it's a parasite. Okay, it's also showing up as malnutrition and anemia. How many people out here that when they do their blood work, they find out that they're anemic? Malnutrition and anemia. Worms consume the host nutrients and damage tissues, hindering absorption of vitamins and iron. Hookworms alone can cause significant blood loss and iron deficiency anemia. Fatigue, cognitive issues, and growth impairment. Oh, I'm just kind of a little foggy. My brain is a little foggy. Maybe you need to take a parasite cleanse. Nutrients stolen by parasites can cause tiredness, impaired memory, and learning in children, stunt growth, and poor school and work performance. Bing, 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 bing. Sometimes we see our kids in a little bit of stress and distress and tired. Give them some warm medicine. Okay? Immune system dysfunction. Chronic worm infection skews immune response towards Th2, weakening immunity to vaccine and other infections like TB, HIV, and malaria. Systematic effects. Parasites can also affect muscles, joints, skin, respiratory system, liver, bladder, and rarely the brain, causing symptoms like joint pain, rash, neurological damage, seizures, and other abnormalities. Mental health impact. Some studies link high parasite load with chronic infection, depression, mood disorder, and immune neurological effects. Parasite cleansing. When people say versus what science says. Claimed benefits. Many cleanses boost that herbs like wormwood, black walnut, which that's what I'm taking today is black walnut, oregano, papaya seeds, garlic can detox parasite naturally. So if we're really boosting up the garlic intake when we're cooking, that's also helping to keep the parasite count down in our system. Why evidence falls short? No robust clinical trial. See, so they're not out there studying these things because it makes money. If you come to the just go to the hospital instead of doing a simple parasite elimination at home. You could go to the hospital because somebody got to make money. Risk and drawbacks. Cleanses are largely unregulated. Some contain untested herbal compounds or natural laxatives that may cause harm. That's fear. Relying on cleanses instead of seeking medical treatment can delay proper diagnosis and effective medication, letting infection worsen. So we're not waiting until we're infected. This is a preventative method. We're supposed to be detoxing and making sure that we're taking care of our body as far as eliminating parasites and worms ahead of time before we get ill. Okay? Historical cleanses, then what our grandparents did, and now what we're not doing. In traditional societies, periodic fasting, botanical medicine, and cleansing were commonplace and combined into border health rituals. They also locked modern sanitation and medicine. Today, we believe we benefit from clean water, vaccine, anti-parasitic treatments, and hygienic, regularly reducing common parasites. Well, that's what we're thinking, that, our water is cleaner and we have higher income countries and we're not seeing the infection. Yes, we are. It's still here. It's still here. However, our sanitized environments mean less exposure to microbes that can once help develop a balanced immune system, and a concept central to hygienic hypothesis. So why don't we do cleanse rituals anymore? Improve public health infrastructure, clean water, sanitation, medical advance dramatically reduce parasite burdens. Or do they? Are we really getting rid of our parasite burdens, or are we just walking around filled with parasite and worms, where it's coming out in the brain, showing up in different places, and we're not aware of it? We're thinking it's cancer or it's something else. Bottom line, parasites can cause real harm: digestive disorder, anemia, immune dysfunction, fatigue, cognitive and developmental issues, even chronic inflammation and mental health issues. Cleanse, despite being trendy, they lack solid evidence for eliminating parasites reliable, and no substitute for medical diagnosis and treatment. Traditional cleanse can serve people well in the past, but today, clean water and healthcare system offers safer medical valid methods. If you suspect a parasite, see a qualified medical provider for testing if needed. To prescribe anti-parasitic medication, many are highly effective and safe. What if we just go back to basics? What if we just go back to basics? We can eliminate a lot of issues. Okay? I want to go over with you 2 recent cases that showed up in different medical journals and in the news, about one lady, 42-year-old, out on Long Island, that had this thought she had a brain tumor, and instead what she had was a parasite on her brain, and they had to go in all the way into this woman's skull to take this mass out to find out that it was a live parasite just sitting, chilling on her brain, giving her She was having symptoms like lapse memory. She was dropping objects, confusion, insomnia, nightmare, occasional hallucination episodes from a parasite on her brain. All right, so what if we go back to basics? Preventative method. Don't wait until these things happen before we address them. All right, I'm going to give you the detail on two cases. So this is one 42-year-old woman on Long Island, and this happened during 2018-2019 period, and even more recent, a lady in Australia that ended up with a round worm in her brain as well. She was 64-year-old woman in southeast New South Wales. I'm going to let ChatGPT read to you these two cases of parasites not long ago. Two different cases that's all out in medical journals and the news. Here we go.
Here's a deeper look at both cases. 1. Rachel Palma, New York, 2018-2019. Background and symptoms. Patient, 42-year-old Rachel Palma from Middletown, NY. Symptoms. Early 2018, memory lapses, dropping objects, confusion, insomnia, nightmares, occasional hallucinatory episodes. Site turn search 4 turn search 10. Imaging. MRI showed a solitary lesion in her left frontal lobe, interpreted as possibly malignant. Site turn search 2. Surgery and unexpected discovery. Procedure. Craniotomy in September 2018 at Mount Sinai Hospital. Expecting tumor resection. Site turn search 2. Findings. Instead of tumor tissue, surgeons removed a firm cyst, quail egg-like, which under the microscope revealed a live Taeniosolium larval tapeworm. Diagnosis. Neurocysticercosis. Site turn search 39. Treatment and outcome. No chemotherapy or radiation was needed. Surgical removal resolved her neurological symptoms nearly completely. Site turn search 10. From weaning off misdiagnosis to relief. Every headache is not a parasite, she cautioned. Site turn search 10 turn starring. Clinical insight. Neurocysticercosis. Caused by ingestion of T. solium eggs from contaminated food or hands, larvae migrate via bloodstream, forming cysts in the brain. Often confused with tumors on imaging. Site turn search 13 time. Diagnostics caveat. Imaging alone can mislead. Biopsy confirmed the correct diagnosis inside the operating room. Site turn search 4 turn search 13. 2. Australian python roundworm, New South Wales, 2021 to 2022. Background and symptoms. Patient, 64-year-old woman in southeastern New South Wales. Early symptoms, Jan 2021. Abdominal pain, diarrhea, dry cough, fever, night sweats. Later, 2022, forgetfulness and depression. Site, turn search return news 19. Imaging. CT scans showed migrating lesions in lung, liver, spleen. MRI revealed a suspicious frontal lobe lesion. Site turn search turn search 1. Surgery and shock discovery. See. In late 2022 at Canberra Hospital, during a brain biopsy, the surgical team pulled out an 8-centimeter live nematode. Turn news 19. Identification. Confirmed as Ophidoscaris robertsi, a carpet python roundworm never previously seen in humans. Site turn search 1 turn search 29. Treatment and follow-up. The patient received antiparasitic medications post-surgery. 6 months later, her cognitive symptoms had notably improved, though monitoring continues. Site news 19 turn search 1. Clinical insight. Zoonotic spillover. Likely infection from eggs deposited in environment via snake droppings, to foraging on local plants, warrigal greens, bearing the eggs. Site turn search 20. Global relevance. This marks the first ever case.
So they're thinking that she might have ingested the eggs from infected dropping in the environment. Yuck. And then it goes through the digestive system in and ended up on her brain. That's crazy. Now, when it says site turn search, that's where ChatGPT is telling you, it's giving me in writing where it's getting this information from. It's not just pulling it out of the sky. This is where ChatGPT goes through the research of finding medical journals, articles, news report, and this, when it's saying site turn search, that's where it's getting the information that it's reporting.
Of O. Roberts site infection in a mammal's brain. Site turned or news 19. Importance of biopsy. Despite modern imaging, the definitive diagnosis came only through surgical pathology. Key comparisons feature neurocysticercosis, python roundworm, Australia. Discovery form encapsulated cyst parasite type. Tania solium larval tapeworm. Ophidascaris robertsi live nematode. Found during craniotomy for assumed tumor. Brain biopsy for mystery lesion. Discovery form encapsulated cyst quail egg. 8 centimeter live wriggling worm. First human case? No.
Wriggling worm. Yuck. That means that when they pull that thing off that woman's brain from the craniotomy, that worm was dancing and moving around. Wiggling worm. How scary is that? To have a wiggling worm on your brain where MRI is showing as if it's a cancerous lesion. Something that you can prevent by just taking anti-parasitic medicine like black walnut hull tincture. Oh my goodness.
Cysticercosis well documented. Yes. First human brain infection reported. Treatment, surgical removal, no drugs. Surgery plus antiparasitics. Why these cases matter. Imaging, final diagnosis. Both tumors turned out to be infectious lesions, cyst and live worm. Surgical pathology is crucial. Only direct visualization under the microscope or forceps revealed the true culprits. Emerging infections, particularly the python worm case, showcase risks from animal-human overlap and zoonotic spillover.
Okay. Comes from human overlap, animal-human overlap, and zoonotic spillovers. So that's interaction with animal where we're exposed to parasites that's finding its way through the blood to our brain. Simple methods of getting rid of these parasites before they become something in the body and getting to the brain. Get your black walnut tincture, and you can find this on Amazon, guys. You don't have to make it like I do, but here we go. So thank you for going down the rabbit hole with me this morning as I drink my anti-parasite shot. Thanks for watching. Goodbye.